It happens when people slow down. If I had a person that retires, I warn them, have something to do after you retire. Because everybody knows a friend that retired, sat their butts down in a chair and died within 5 years because they stopped moving and didn't really have anything to do but watch reruns of Westerns all day. So I really do encourage people, never slow down, never stop, because once you do, that's when you start aging, is when you stop doing things.
Welcome to In Good Company, Elder Care in Your Backyard.
Our guest today is Dr. Cody Hooten, a physical therapist who has been with Haven Home Health Hospice for about 10 years. Cody has worked both with outpatient clinics and home health, and he has a really unique perspective on what separates people who stay active and independent in their 80s from those who begin to decline much earlier. He believes great healthcare goes beyond treating a diagnosis. It's about treating the whole person and helping patients build healthier lifestyles that support long-term independence and quality of life. Dr. Cody, welcome to the show.
Good to be here.
All right.
Cody, tell us about your background.
I've been doing home health for the last 5, 6, 7 years. And prior to that, I have a background in outpatient. So I've worked with a very wide scope of people with all kinds of obstacles that they have in their lives.
And when you were seeing people in outpatient and people now in home health, is there a wide range in the difference of type of patient that you're seeing or different diagnosis that you're seeing?
Absolutely. I mean, in the outpatient setting, you see people that are a little bit stronger than in the home health setting. They can move a little bit better sometimes, but you can still see anything from chronic pain to stroke to some disease management, both in home health and in outpatient therapy. But with outpatient therapy, you're typically seeing more of your orthopedic issues, chronic pain, and things like that. In the home health settings, we kind of expand it to a little bit more general medical care and some symptom management to help people stay in their homes safely and strongly, confidently.
Are there any things that you feel like when you go see a patient in their home, or if you've had a patient come to you an outpatient, that they're kind of surprised about like how physical therapy is supposed to work?
With my patients, I get that often because I don't just do normal, simple physical therapy exercises. I look at the bigger, entire human being that's sitting in front of me. Exercise can be a very big and important piece, but if a person doesn't feel well, they're not going to exercise. If a person doesn't have the motivation, they're not going to exercise. So you're going to have to remove some of these barriers that keep people from being successful and moving more. So sometimes just focusing on helping people feel better, get a good, healthy base, that really helps them start moving and exercising on their own.
Yeah.
And then we can get into some more of the very specific physical therapy type activities that help people continue to build strength and resiliency in their homes.
That totally makes sense. So if we have someone, maybe their parents are at home and they're like, well, they can still walk, like they should be fine because they can just walk around. Are there things that you could caution like an adult child to look for in their parents' functional mobility that might give them some clues?
Absolutely. Unfortunately, as we age, we don't get stronger. Like that's just not how the aging process works. Younger people, they have the benefits of not being physically active. Like I can take myself to the bathroom, no problems. As we age, you have to go offensive on some of this movement things, or natural aging will wear you down to the point where you can't do that. So I really do encourage my clients who can get to the bathroom okay today to go on the offensive and make themselves stronger so they can maintain and improve their lifestyle that they have now. I really try to prevent people from getting older as much as I can. And you can be very proactive with just doing some very simple physical activity throughout the day. And it doesn't have to be overly complicated. Some little interventions can go a long ways.
How many of your patients were like actively exercising prior to you coming to see them, at like before like a surgery or some incident occurred?
I would say my home health population is not very big. I would say like 10 to 20% of them probably, and I don't have any numbers to support that, but
Yeah.
a very small minority exercise before I see them. And I would say the same thing about outpatient too. I don't see a whole lot of physically active people,
Right.
unless they've had some kind of weird fluky injury like a car wreck, or I saw one lady who broke a hip playing golf. She fell down a hill.
Oh my gosh.
But most physically active people, I don't see a whole lot on the home health side because
Yeah.
they typically are in better shape.
Did you feel like those ones that were physically active before recovered quicker?
Absolutely. And that's not an opinion. That's research based. Like people who are physically active, they overcome these injuries quicker. These setbacks, they overcome them quicker. They don't have the challenges that a sedentary person has. Sometimes the sedentary people can get to and from the bathroom before, borderline, but then they get some kind of pneumonia and then they can't do it afterwards.
Yeah.
Where a physically active person, they still have enough strength after contracting pneumonia that they can get themselves to the bathroom, maybe with a walker or a cane, but the stronger you are having anything happen, usually the better your outcomes are.
Is walking enough or just calisthenics?
It is very important. I would say, and I preach this to my people all of the time, walking is the best exercise that we can do from a musculoskeletal and a cardiovascular standpoint, especially in the older populations. But the research on resistance training is really good, especially for older people. And when I say resistance training, that's moving your body weight or moving some weight. And it doesn't have to be like bench pressing 100 pounds or doing dumbbell, but any kind of extra weight that you can move that helps our bodies out a lot, especially in our aging populations and women.
Okay.
What are some things physical therapists know about the human body that most people don't?
We are, and this is again research based, like most physical therapists test higher on anatomy than most of your medical doctors, some orthopedic surgeons.
Wow. Okay.
They really are movement muscular experts. And also the wide range of knowledge of a physical therapy, especially coming out of doctor of physical therapy programs nowadays. We have a very wide range of knowledge because you never know when you're going to run into some of these neurological or vascular issues that aren't necessarily a physical therapy issue until it is.
Gotcha.
And we can also identify those and refer them to the specialists that can help that person out the most.
Gotcha. Now, most people think physical therapy is either for recovery after a surgery or helping something along those lines. What are they missing? What are the misconceptions?
That's a big debate in the physical therapy profession in general right now. The physical therapy leadership would like us to push into more of this open space of wellness and healthy lifestyle changes and things like that. Unfortunately, we're still seeing a lot of post-injury or like activity optimization. We see a lot of that still, but there's a lot of space for preventative care in healthy populations and athletic populations. Like there's a lot of benefits that are underutilized there. And unfortunately, I think a lot of it has to do with payments, but I don't know a whole lot about that.
That's okay.
Yeah. We had a Adam Kyle with Kyle Insurance on yesterday, and he talked a lot about Medicare Advantage versus Medicare and a supplement. And he said that if you want outpatient therapy, Medicare to supplement's a little bit better because oftentimes there's a very limited number of visits. So not to get too far off of the physiology of this, because I want to come back to that big time. But what are you seeing today as far as limitations on how many therapy visits people are getting today versus when you started a little more than a decade ago?
Makes me feel old, John. Makes me feel real old. Well, home health and outpatient have a little bit different billing and visit counts. So speaking on the home health aspect, it really depends on what kind of Advantage plan or traditional Medicare plan a person has. Some plans do count visits. Some plans do not count visits. And so it really just depends on what plan a person has as far as how many visits that I can offer somebody. It also has to do with how well or how not well the person is. And if an insurance company is being stingy, I have no problems putting whatever documentation I need to fight and try to get more visits for that person. But sometimes it just seems like the insurance companies will spin a wheel and that's how many visits you get.
Yeah. Yeah. And so you've had to appeal some of these. How successful have you been to override those denials? Moderate success. I think a lot of it is seemingly random because I'll think I have a good case and then get denied. I just can't really guess with my clients, and that's really frustrating. Yeah, that's hard. Let me circle back to the physiology of things. So when you have someone who is slowly, over time, naturally we're going to get weaker over time. What age does that start? It just depends on the person. And it depends on what kind of lifestyles you have chosen to live your entire life. Like if you choose to smoke, chances are that's going to happen a lot sooner, or heavy drinking, or today they're saying sitting is the new smoking. So a lot of sedentary lifestyles, you're going to see these agings happening sooner and sooner in life than later. Doing our best to avoid some of these diseases like congestive heart failure and diabetes. Those are mainly preventable diseases if we take care of our bodies in our 20s, 30s, and 40s. But if you don't, then you'll see that aging happen a lot sooner than what most people plan for. Well, let's say they eat fairly decent and they maybe do a little bit of walking, that sort of thing. In general, what age would you think that, you're going to start to see a bit of a decline in your strength? I would say the average person I see, again, it's kind of different. I hate giving it an age, but it happens when people slow down. If I had a person that retires, I warn them, have something to do after you retire. Because everybody knows a friend that retired, sat their butts down in a chair and died within 5 years because they stopped moving and didn't really have anything to do but watch reruns of Westerns all day. So I really do encourage people, never slow down, never stop, because once you do, that's when you start aging, is when you stop doing things. So I would say, if I have to give you an age, I would say around 70s, early 70s. Okay. Because people are retiring or have retired and have kind of started to slow down. Right. But I would say 70s, early 70s is a lot of times when I see it. And that decline is fairly rapid? It can be. Yeah. It can be. Sometimes you can catch pneumonia one time and you never quite make a bounce back. And it can snowball really quickly out of hand. Our health is one system affects the other, and then you're looking at 4 or 5 different diagnoses that are life-threatening. And it can get out of hand quickly. Yeah. So speaking of that, one of the number one reasons people go to the hospital, aging adults go to the hospital, is because of falls. I wanted to kind of dig in a little bit on what are some of the cascading effects of somebody who's had a significant fall in the hospital. So the first thing I would look at would be the causes of these falls. Why the person is having these falls. Because most healthy human beings just don't start falling. Like us, we don't just fall and walking across the room. Most people have a urinary tract infection, or they have pneumonia that's not diagnosed, and they have some kind of sickness, and then they fall. And they get to the hospital, and they're like, "Oh, yep, you have a broken hip. Also, did you know you have a urinary tract infection?" I see that quite a bit.
Also look at medication discrepancies. Sometimes some of these side effects with medications can cause dizziness. So I want to make sure medications aren't causing some of these falls too. And there's some medications that are more likely to cause that. And most of the doctors prescribing them are aware of those medications, and they'll make quick changes, hopefully. Then I'll start looking at like environmental factors. Can people, are their paths well clear? Are there toys everywhere on the floor? Do they have good lighting? Seniors heavily depend on vision for their balance. So making sure their eyes can actually give good information to their brains, that helps keep a lot of people off the ground.
Yeah, that makes sense.
Of course, being strong and having good muscles, that helps us with our balance. Strong legs are balanced legs. And so the research suggests the stronger your legs are, the less likely you are to have some of these falls. But those would be some things that I would start looking at and advising people on how to prevent falls.
Yeah. There is some research out there that indicates if somebody's had a hip fracture, that the likelihood of them having another fall or a series of falls with injury sometimes goes up. Why is that?
Another scary thing is the mortality rate after a hip fracture is typically around 5 years.
Wow.
Yep. That's a research thing too.
What do you think causes some of those issues?
The falls and fractures, or the mortality?
The mortality, the increased chances of having another fall. What are some of the factors involved there?
So unfortunately, the mortality part of it is because they've stopped moving. Just like when people retire, they stop moving. The body is designed to move. Mm-hmm. Like you've got to have it to have a good lifestyle. And so unfortunately, when I see people that have had some of these hip fractures, it's a big life event. It's a lot of pain. They're in the rehab for 3-4 weeks. And then they have to have home health for a while. They get to have home health for a while.
Yeah.
It's a big event, and that causes people to be fearful of falling. And that is a big, it makes people not move as much because they're afraid of getting to and from the bathroom because they had this terrible event happen. So I see the fear of falling as a big detractor from people's health.
Yeah.
But then, of course, after we have some of these orthopedic injuries, like a fall, your muscles typically take a hit after that too. I think there's like a 10% loss in overall strength after you recover. I can't remember the exact numbers on it, but it is a significant number of strength loss after some of these orthopedic injuries. So that plays a little bit of a factor too. But I really do think it's because they've stopped moving. They lose a lot of strength as a result of this fear and from the injury itself. And they just never rehab back to their prior level of function. They never return to their prior level of function.
If physical therapy was used more proactively, how would that impact the aging process?
If physical therapists were able to successfully talk to a big group of people, I would hope they would be more motivated to stay physically active. Mm-hmm. In the research, it's not great for physical therapists, but it's good for humans. Like they did a study that said Pilates was very comparable in outcomes to structured physical therapy. And I think that just speaks about the power of movement, the power of always be moving. Mm-hmm. So I would hope physical therapists would encourage just your general population to find what you like doing and make it active. Be moving your body, have your weight through your feet. And so that's what I would hope physical therapists would focus on is exercise doesn't have to be a bad experience. You just have to find what you like doing and make that fun and physically active. And I would hope they would push for that more than traditional exercising.
The people that you run into that aren't physically active, have they ever told you maybe why they're not physically active?
I've had people tell me they just don't like exercising. I have people that there's a laundry list of reasons why people don't like moving. Some people deal with chronic pain, and that's a big detractor for movement. Mm-hmm. Some people have never been physically active in their lives. Maybe their parents were not physically active. And so you can see kind of a generational sedentary lifestyle passed down. But there's a lot of reasons why people will not move their bodies. It's a very small part of the population gets the actual recommended exercise per week. It's a very small number. And I wish I knew that off the top of my head, but I don't.
That's all right.
That's okay. Have you noticed patterns between people who recover more quickly versus those who struggle?
Yes, people who recover more quickly, they typically take care of their bodies before they've had whatever setback they've had. They eat clean, they eat like they're supposed to. They avoid some of these external stressors that slow healing processes down, like smoking, like excessive sugar, alcohol consumption, high levels of stress, and things like that. They're typically more physically active beforehand. Their bodies move. I won't say always, but they usually do a lot better than the person that is more sedentary and more sickly before some of these setbacks happen in life.
Gotcha. Where does sleep fit into this?
Sleep is huge.
Okay.
The research on sleep is if there's a chronic disease, there's poor sleep tied in with it.
Okay.
The research suggests 6 to 8 quality uninterrupted hours of sleep per night. And the quality is incredibly important because you can have people that sleep 12, 16 hours a day, but they toss and turn, and maybe they have undiagnosed sleep apnea. And so some of these chronic diseases go hand in hand with poor sleep. Diabetes, Alzheimer's, dementia. In fact, they're calling, well, I don't want to go down there, but yeah, dementia, chronic pain, depression, all of these things are very hand in hand with poor sleep. So
Gotcha.
Very important. Also, our recovery needs sleep so our bodies can rebuild what's been broken down.
What kind of advice do you give around hydration?
So I want to make sure there's no restrictions from their doctors. Some people do have some fluid restrictions, so I check on that first. A lot of, especially older people, have a hard time getting in a lot of water. The research is everywhere on as far as how much fluid you should drink. I usually tell people, let's shoot between 50 and 60. And that seems like a low number to me, but
Ounces.
Okay,
just to clarify.
Yes, gallons.
Oh my gosh.
But even 50 to 60 ounces is a lot for most of my seniors. Like, they give me giant eyes and think there's no way I'm ever going to do that. But yeah, I usually tell people, let's shoot for around 50 to 60 ounces first and see how you do with that. But I would say a better number is a lot more than that.
Yeah. When I was practicing, it seemed like there was kind of this domino effect. So they sometimes started having some urgency going to the bathroom, some incontinence.
That's a big reason they reduce their drinking.
Yeah. And then that perpetuates into other problems, isn't it?
Right. I'll tell people all of the time, if their blood pressure runs a little low, the first thing they should do is drink 6 to 8 ounces of water, because our blood volume is a majority water anyways. So if you're feeling weak and dizzy and just not well, like, you could have low blood pressure because you haven't drank anything or have only drank half a Diet Coke or something like that today. Water is very important. We can look at back pain, like our discs between our vertebrae. They're made of 80% fluid. And so you got to rehydrate those discs or they squish, and that can cause some issues with back pain too.
Interesting.
I could keep going on the benefits of water, but
please keep going.
Rock and roll as I have some water.
Please,
yeah,
drink
I'm gonna
up.
take a drink myself.
Drink up. That's right. We get again back to the blood, the amount of water that's in our blood. That all goes to our head. So you actually get smarter drinking more water. Your cardiovascular system, your heart doesn't have to work as hard if there's more fluid in your system. So there's just benefits everywhere. Our skin likes having lots of water in it. So if we're worried about wrinkles, drinking enough water helps with that. We could talk about bowels. Like, if we have issues with constipation, that's the first thing that I usually recommend to people is make sure you're drinking plenty of fluid. So things move well. So there's we keep going.
What
Those are some good
what
ones.
about the urinary tract?
Urinary tract is a good one. It kind of ties in with kidney health too. The kidneys are responsible for filtering fluids that come into our bodies. So when we drink Diet Coke or whatever soda, or whatever we drink, our body has to filter and pull all of that water out, which is extra work on a lot of our kidneys. If we don't drink enough, our kidneys recycle and recycle and recycle what little fluid it has, and that can lead to some urinary tract infections too. So making sure we're plenty hydrated helps flush out some of that old fluid in our system and helps keep things nice and clean.
Yeah. And I think you mentioned it earlier, the medications can increase the need for filtering, and the urinary tract infection causes dizziness.
It can.
And can perpetuate. So you've got somebody who may already have some weakness, and then they have some incontinence, maybe related to some medication, maybe not, but they then go down the path of decreasing their hydration and now increased chance of, so it's this vicious cycle that happens. And sometimes if they've had a fall, it perpetuates this feeling of, I don't want to have to get up and go to the bathroom because that I might fall. Correct. So I'm going to modify things so I don't have to get up. And so I've just made things 10 times worse.
Yes.
I'm more sedentary.
Yes.
So it just seems like this vicious cycle that just kind of perpetuates itself. And if they don't have a caregiver or, a family member who can identify some of these issues, you hit it right on the head. Like 5 years is not very long. And, a lot can happen in that 5 years. A lot of hospitalizations, a lot of pain because
slow
of
decline.
Yes. And unfortunately, in some, it's very painful decline as well. And that's one of the things that we want to try to emphasize here is just people need to have alternatives so that they can protect themselves. So what's your advice to family members who may be worried about parents that are they're still getting around, they haven't had a fall yet? What's some advice for them?
I would say before I answer that, my average patient is a 70-ish year old lady who's had a urinary tract infection and a fall. Like that's my most common person that I see in the home health field.
So kind of an epidemic.
Yes, I would say so. That's my average patient. But speaking towards that, if you're a child who has some aging parents and you start to see them kind of decline, I would encourage them to get some external help in the house, because you can't really take a lot of healthcare advice from your loved ones. It doesn't go over very well. I haven't seen too many kids that get onto their parents about taking care of their bodies and that be a successful endeavor. Like, it just doesn't happen a whole lot. So I would really encourage them to get some outside assistance, whether that's their doctor, whether that's getting a home health physical therapist in, to give them some kind of interventions, to functional interventions, to have them start turning things around, because it is a big commitment to changing lifestyle changes. Fads do not last long term. We do something for a short period of time. Sure, it's going to help, but in the grand scheme of things, encouraging people to change their lifestyle is a very hard and a very disciplined action. So I would encourage them to get some outside external help from non-family members to put some strategies in place to get the person moving safely again and responsibly.
Yeah. So let's say I'm one of these 70-year-olds that you're concerned about. What's your pitch when you're starting out, just trying to talk someone into a lifestyle change? Where do you start?
Well, first I'll start by figuring out what bothers them the most. Like, if you don't like going to the bathroom, then we need to figure out whatever obstacles are keeping you from getting to the bathroom. And that's why you're not drinking. That's why you're not eating anymore. That's why you sit in your chair all day, because you're afraid of falling on your way to the bathroom. So I'm going to do whatever I can to encourage you to start moving and to start eating a little bit healthier, because food is incredibly important when we're talking about this recovery process as well. So whether that's equipment to help you feel safer and kind of bridge this gap, like maybe we will encourage a lift chair for a little bit or a walker for a little bit, just to get the person moving again, and to the point where they don't need these devices anymore. And then we can start working on the next step, no pun intended, which maybe we will start getting outside a little bit when they feel safe to do it. And then maybe we can expand on doing a little bit of cooking, because now they can, because they've taken the steps to be able to do some of those things. And they're not ordering McDonald's in and out or eating powdered donuts for breakfast and things like that. So whatever that person's pain point is, figuring out the most efficient solution would be what I would do. And it really depends on a per person basis. I talk about sleep with a lot of my people, because if we can solve some of their sleep, some of their issues of dozing on and off all day, some of that gets fixed. Mm-hmm. Talking about some stress, like stress can cripple somebody to not move, whether it's family stress or whether we're talking about not eating because we're smoking cigarettes on and off all day, or drinking a lot. Whatever interventions we can put in place to kind of change some of these not so good health outcomes to enable people to do what they want to do.
That's good. That's really good.
What's the emotional impact of a patient who has lost their mobility, and how do you help them overcome that?
Always a per patient basis, but I would say when somebody loses their mobility, if they had it before, like it's a complete identity change. Like I used to be able to go to my volunteer group. I used to sit with people at the hospital. I can't do that anymore, and I don't know what to do with my time. And so you do see a lot of quick depression. You do see kind of a retraction from society, because you can't do these things that you used to do anymore. So it can be a huge negative on people's lives when they can't move and do what they wanted to do anymore.
How do you help with that?
Implement strategies to help get them back to that. Whether it again depends on the person, but I want to meet that person where they are now, what they can do now safely, and build on that. I'm not going to have somebody that's been sedentary for a year. I'm not going to have them start doing cartwheels and push-ups and things like that. But maybe we can start walking short distances across the house. Maybe we can get up and down from the chair 5 times today. Maybe next week we can double that. It just kind of depends on how much work a person puts in it. So our bodies, they adapt to the stresses we place on them. So if we slowly put more and more and more on them, even older bodies, they will get stronger as long as you feed them and as long as you move them like you're supposed to. That's biology. So
could you share for us a success story that you've seen?
Success story. I can look at this gentleman here. I saw him this morning. He's had a neurological condition his entire life, and he can't control one of his legs very well. His nervous system makes his foot pump. It's called clonus. And he has been confined to a wheelchair until we started working with him. We started about 3 months ago, but we've started working with him we started by standing. He couldn't get out of his wheelchair very well. So we started by standing up to the countertop, and he did his stuff. Like he worked at it daily, consistently, stood up to his countertop, stood there as long as he could until he got tired and he'd sit himself back down. We walked 150 feet this morning when he wasn't able to do that 3 months ago.
Wow.
But because he was consistent about it, this guy that's had a neurological condition his whole life, he's able to walk himself to the bathroom now, and he's confident about it. Like he doesn't have to think twice about it. And that's great for this guy. Like I'm very happy that he can take himself to the bathroom without transferring from a chair to a wheelchair, wheeling himself in there, transferring from a wheelchair to the toilet, which some people have to do, but he doesn't have to anymore.
That's great.
One of the things that I'm curious what your thoughts on is you'll hear some folks say, "Well, I'm too old. I'm
It's a
just
very
too
common thing.
Yeah,
I'm 88. I don't want to do that.
When is too old?
There isn't a too old. Old, I don't know why at some point we thought that old means weak. Old does not mean weak. How we take care of ourselves is when we get old, or if we stop taking care of ourselves, that's when we get old.
Yeah.
There's no research that supports age as an indication of your function. I think the oldest guy that's completed a marathon, I think he started running marathons when he was 86.
Wow. Oh my goodness.
It was some guy in England. But yeah, I can't remember how old he was when he finished, but I think he was 102 when he finished his last marathon.
Wow.
But he started when he was 86 running marathons. That's when he started his distance training.
Yeah.
So old is not an indication of function. It depends on how you've taken care of your body.
There's a great documentary, and I forget the title of it, but they look at competitive athletes in their 70s and 80s, and I think even in their 90s, swimmers, long jumpers.
Yes,
just things you would be like, they're going to definitely break a hip. Nope. They've been doing it for years. And I think people think, well, those people are some genetic abnormality, but I don't think that's the case, actually.
And maybe they are, but those people have worked at it. Like, they have stuck with it. They don't take no as an answer. When they did break an ankle, they got right back up and got back to it. So it all just kind of depends on, sure, there might be a little luck in it, but they've made that luck through physical activity, through taking care of themselves, through sleeping like they're supposed to. Yeah. All the things we've kind of touched on earlier today. It's not an accident.
So how much of it is mental?
It being your physical abilities, I would say all of it is mental. Like, if I sit in a chair and don't do anything, then I'm going to lose that physical ability. Like, the mental has to be there to maintain the physical. You have to want it. You have to do it.
Yeah. Yeah. And I do think that some people need help. They're unless they put themselves in a particular situation, they're not going to do it on their own sometimes. And so you mentioned earlier, just getting some advice, getting some medical advice, getting some help. And there's tons, because we're in this baby boomer wave right now, and so many people are aging. There's so many programs out there locally that are really designed for older people to really change the narrative about what aging is supposed to look like. And I think these generations that are coming up need to hear that the road that your grandma went down or your grandfather went down doesn't have to be the road you go down.
Correct. It just is how you take care of your body and what you want to do with your life. But yes, sometimes you do need some kind of external intervention. And ultimately, the person has to be open to change. And I see a lot of people that have a hard time with that. So if they're not willing to make any changes in their lives, that makes things exponentially harder on them.
Yeah.
So convincing people to change is part of my job, and a very challenging one sometimes.
One of the things that we talk about on the show, we talk about, the 5 pillars, and you've covered many of those, but, making sure the home environment is kind of like one of the first ones that we talk about. What are some basic changes that you would make to a home environment when you go in and look at it?
I'm a firm believer in your home is kind of your state of mind. So homes that are cluttered, I want to make sure that they're as clean as we can. Make sure pathways are clear. I want to make sure they're very well lit. I love natural light, and if we can open some windows and get some fresh air in, I think that's very helpful. There's some really good research on sunlight and how that affects all of our bodies. Everybody knows about vitamin D levels, but also some of the rhythms that our bodies go through, and the importance of light hitting our eyes. So I want to make sure things are very well lit. I like peaceful environments. I don't like a lot of noise because that's all extra resources that our bodies have to use. Less stuff.
Less clutter.
Yes, less clutter. I think that's very helpful. Now, talking about people with mobility challenges, making sure the house is very accessible is also very important. Make sure we've got adequate ramps and make sure we've got adequate support bars to get in and out of the bathroom, on and off of the toilet. That all helps people move and do what they need to do as well.
A lot of falls happen at night when somebody's trying to go to the restroom.
Yes.
What things do we do to help avoid that?
I want to make sure medications are okay, because sometimes we get prescribed these sleeping medications and we don't quite wake up on some of these trips to the bathroom. So I want to make sure that we're not having an issue with medications first.
Yeah.
But I want things to be very well lit when people are walking to the bathroom, especially seniors who need light for balance. They need to be able to see for balance. So I often encourage motion sensing lights so people don't have to flip on a lamp or something like that. They can just move,
Smart.
put their feet on the ground and they trip that sensor and now the room is lit up. So I encourage a lot of those motion sensing devices, making sure they've got a nice clear path to the bathroom, making sure doorways will fit, because a lot of people have these little narrow doorways, and sometimes even changing the walker wheels, they can fit in the bathroom now.
Yeah.
Like little tricks like that help people get to and from homes safer. And some of your newer homes, you're starting to see better access to them. You're not seeing those tiny little bathroom doors, so people can get in them. But doing whatever we can to remove those barriers, safety barriers, to keep people from getting to the bathroom safely at night. But medications keep things well lit and make sure pathways are nice and clear.
Do you sometimes recommend a commode?
I do. If these working on our physical fitness at 2 a.m, walking to the bathroom is not the time. So I will often recommend a bedside commode for everybody's sake. Nobody wants to help mom to the bathroom at 2 a.m. Mom doesn't want you to help her to the bathroom at 2 a.m. But she might be able to just transfer over to a bedside commode, use that, get back in bed, and she can go to sleep a whole lot quicker than walking to the bathroom, which can sometimes take a very long time.
Yeah.
So bedside commodes can be a very useful tool to help us get back up on our feet.
What about bed height?
Bed height. I don't like stools that people need to step up into their bed height. I don't like box springs either. They make beds unnecessarily high. Bed should be, when I back up into a bed, I should be able to sit on it and not be afraid of sliding into the floor. So that bed would probably be way too high for that individual. So I do like beds that are a little bit lower to the ground, not so low that they have a hard time getting up, but
Right.
I like it where they can comfortably sit on the bed, and sometimes just removing the box springs, that does the trick. But also bed rails. They sell bed rails on Amazon, $30, $35, $50, just a small little frame. That helps people immensely getting in and out of bed. So that's another good tool to help people get in and out of bed safely.
That's great. Going down the pillar list, you mentioned medications and nutrition and hydration, exercise we've talked about. Social isolation is the last.
There is an epidemic of loneliness out there. That's kind of a buzz thing in today's healthcare. People who don't spend time with people they like, they don't have a very good quality of life. Human beings, whether you think you're a hermit or not, you need socialization with people that you like. It is well documented that social people, they tend to have better quality of lives, both with their health, both with their outlooks, and their mental capabilities. It's all helpful to be around people. So finding groups you enjoy spending time with is important.
Yeah. We had a guest on and he quoted some research where I believe, was it as if they're socially isolated, like a hermit kind of.
Mark Applegate.
Yes.
Yeah. And he mentioned that it's like smoking a pack a day.
Yeah, that's I've heard that before, and I would agree with it too.
from a health perspective. At
and
least.
shortening your life.
Yeah.
Yes.
Yeah.
Yes.
For sure.
Wow.
Yes.
For listeners who are more sedentary, who don't want to get off the couch, but they do want to change their life, what are the first steps they should take to better themselves?
Have to get off the couch.
Start there. Okay.
Yes. Even if we start by just standing in front of this couch, weight bearing activities where we have our weight going through our legs, that's where you get the most bang for your buck. I'm not a huge fan of sitting exercises because my body weighs 175 pounds. My legs need to be able to move 175 pounds across the room. Some of those seated exercises, you can't simulate that. So really the first step, even though they don't want to get off the couch, is just to stand up in front of that couch. Once we can do that confidently and comfortably, maybe we'll start by doing some tiny little marches. And then maybe we can start taking some tiny little steps and just kind of work our way up and do what that person can do at that place they are now. But you have to get weight through your legs if we want to have a good quality of life. Now, if the person is unable to get up from the couch, maybe they've had a stroke, maybe for some reason they cannot, any movement is better. So sometimes I'll have people start doing some shadow boxing to kind of help keep their cardiovascular fitness up. We can do some weight-bearing activities from a couch or a bed through our arms. That can help us transfer to and from surfaces. There's always something that we can do, but my first objective is try to get people off of the couch if they can, if they have the ability.
And then diet. What should people avoid eating or drinking?
We could do a whole episode on just diet.
How about just the bullet points?
So if we're
or rather, what would you recommend them to eat?
So if my audience is speaking to older people, 70s plus, I tell them to eat like they did as a kid.
Okay.
So in the 60s and 70s, that's when we started seeing this explosion of ultra processed foods coming out of boxes, out of bags. And that's when you started to see some of these chronic diseases, congestive heart failure, diabetes. You started seeing those explode when these processed foods came out. So I tell people, eat like you did as a kid. Eat fresh fruits, eat fresh vegetables, eat plenty of lean meats, good protein sources. I usually tell people, I give a list of good protein foods that are mostly acceptable in whatever diet they have, which is lean meats, nuts, beans, eggs, cottage cheese, Greek yogurt that has low sugar in it. Cottage cheese, you got to be careful with the sodium levels in it. But those are all easy ways that people can eat because those foods are fairly accessible, fairly inexpensive. You can buy a bag of frozen broccoli for $1. It doesn't have to be expensive and it doesn't have to be complicated. Just eat like you did as a kid.
Right on. Good advice. Really good advice.
On physical activity, a lot of people ask how much should I do in a week? And I find it helpful to tell them the research suggests 30 minutes a day, 5 days a week at a moderate intensity. And I actually like that definition. I know moderate sounds very vague, and moderate to me isn't the same as moderate to my patients, but I love that definition because of that. Moderate to that person, I want them to be comfortably tired when they're doing this activity. And it doesn't matter what that activity is. Maybe it is walking across the house, and that person is a little short of breath, but comfortably short of breath. If that person likes gardening and they get comfortably short of breath doing that, great. Go garden, but do whatever you like doing that makes you a little tired. And that would be some good advice that I leave a lot of my patients. Because I don't care how you move, just as long as you do it for 30 consecutive minutes, because that helps your cardiovascular system a little bit more efficiently at that point. But 30 minutes, 5 days a week at a moderate intensity. And that's the physical activity minimum that's recommended through the week.
Fantastic.
Cody, thank you for your advice today. I think a lot of people got a lot of great information on exercise and nutrition and all the ways to try to stay independent as long as absolutely possible.
Glad to be here. I'll come again if you need me.
Will do.
If you enjoyed today's conversation, make sure to like and subscribe so you never miss an episode.
And we'd love to stay connected. Follow us on YouTube, Facebook, and on Instagram at In Good Company Elder Care Podcast.
You can also find us on X, formerly known as Twitter, at IGC Pod, and on TikTok at IGC Elder Care Podcast.
Thanks for tuning in to In Good Company Elder Care in Your Backyard. I'm John Ray, and I've been joined by my amazing co-host, Spencer Ernst. Special thanks to our executive producer, Alex Wallace, for helping bring this show to life. Until next time, take care, and remember, you are always in good company.